If you have a phone and you can text, if you could whip it out right now, this is the call to action, taking action right now, whip it out. Are you ready? We're going to ask you to text VA CARE to 30644. You'll receive a message asking for your address. If you respond with your address, then you'll get a phone call that will connect you directly to your representative's office. Let's blow up their phones and tell them that we demand health care coverage. That's VA CARE to 30644. If you don't want to do that right now, you can do it when you get home, but just remember, it's VA CARE at 30644. While you all are doing that, I want to take a minute to introduce some of the hardworking folks who fight day in and day out in these buildings for expansion for all of us. These legislators are true champions on this issue and are here to stand in solidarity with us when they didn't have to be. I know that they will take the stories that they've heard this morning and share them with their colleagues and tell them that it's the right thing to do to close the coverage gap. So behind me, I've got Delegate Alfonso Lopez and Delegate Marcus Simon. So you get a chance, thank them when the rally ends, because they really are our true champions on this issue. I'd like to take a minute now to introduce Leah Taylor. She's a fast food worker from Richmond, Virginia, and a member of Virginia Raise Up.
Good morning. Good morning, constituents, friends, and family. My name is Leah Taylor. And I am a member of VA Raise Up. And we are here on behalf of all Virginian fast food workers and their families. I have been in the fast food industry for 26 years, and I am a single mother of 6. 4 of them are grown. I've had to scrape by on what very little I make and raise a family on it. After 26 years of working in the fast food industry, I have nothing to show for it. No livable wage and no medical insurance. That is why I joined the fast food workers movement. I am sick and tired of being sick and tired. Since 2004, I've had high blood pressure and congestive heart failure. I cannot afford the blood pressure medicine that my doctors have told me I sorely need. I've had to get treatment where I can find it, but it is not enough. But it's why I am here today, fighting for medical expansion and to close the coverage gap. I make less than $14,000 a year and I have 2 dependent children. I do not qualify for Medicaid. Me and every family I know have fallen into that coverage gap. It is getting harder to work. It's getting harder for working people to get by. We work hard and long and just don't get enough money or benefits. We have children and families that depend on us. It is time for us as Virginians to speak up and pull together. We cannot be in the shadows any longer. If we do not start standing for something, we will keep falling for anything. But it only takes a few good people to make a change. And I see more than a few out here today in front of me. Thank you, and raise up the VA.
What do we want? When do we want it? Yes. So our final speaker is a member of SEIU Virginia 512. Rosalind Gadley is a home care provider in Alexandria, Virginia, who has been without health coverage for the last 3 years.
Hello everyone, my name is Rosalind Gadley and I'm a home care provider from Alexandria. You can't hear me? Can you hear me now? Great. All right. I'm in Richmond today because I'm one of the 400,000 Virginians who do not have health insurance. And why? Because even though I work hard as a health care provider, I don't qualify for health care myself, from the medical marketplace nor through the state's Medicaid programs. I came to voice my concerns about it to the General Assembly members who oppose expanding Medicaid, which would give all Virginians access to health insurance. My union sisters and brothers have worked very hard the past 2 months to individually convince our elected officials that ensuring all citizens is fiscally, socially, and morally the right thing to do. I am here with them today because the more voices that speak together about this issue, the greater the chances they will hear us and act in our best interest. We, the uninsured in Virginia, know what does not work in our health care delivery system. Without health care, I can't afford to see a doctor when I need to. It took me 3 months to get an appointment at the Casey Clinic in Alexandria. I made the appointment because of some GI distress, and while waiting to see a doctor, fortunately, symptoms subsided. If they had not, I would have been another emergency room statistics, or God forbid, maybe worse. Using the ER for basic medical needs is not a responsible use of anyone's resources. If we are insured, this practice could be eliminated. And if you need services from a medical specialist, for example, a heart specialist or orthopedic surgeon or a cancer oncologist, clinics cannot help you at all with those issues. They may be able to find you a doctor here at UVA who will agree to treat you, but driving 2+ hours for several appointments to prepare for a basic surgery, when you have a hospital within walking distance of where you live, but can't access it because you are uninsured, is that adequate health service? No. And though you may not have to pay for much of UVA's service if you're found eligible, but you find out after receiving the service that charges for it were excessive or services were unnecessarily duplicated, well, who really pays for this? And would you call this fraud? Yes. So the clinic system is not an adequate system for the uninsured. Now I know we expect our leaders to consider the outcome of any action they make on our behalf. And we expect them to utilize and protect our hard-earned dollars responsibly. But to oppose the expansion of Medicaid, regardless of the facts, is to deny deserving citizens the opportunity to have health insurance. And this denial is a quality of life matter. Without access to quality, affordable medical services puts us at risk of a life of disability and dependency versus independence and productivity. Denial is also a life and death matter. Without it, we can't get basic blood tests, or dental exams, or breast exams, which could prevent costly and deadly infections and diseases. Thank you for letting me share my story with you. And remember, there are 400,000 other stories just like mine. It's time to close the coverage gap, and it's time to do the right thing. Thank you for allowing me to speak to you.
Their bus is here. I saw her. So she is.